all from my living room. My name is Vanessa McGrath, and I am a Democrat running for state representative in the 175th district here in Philadelphia. With me tonight, I have Ian McLaughlin, a University of Pennsylvania neuroscience PhD, Jen Devor, voting enthusiast and advocate and former 2019 City Commissioner candidate here in Philadelphia, Michael O'Brien, Innovation Fellow at Drexel University's Lindy Center for Urban Innovation, and Oscar Wang, founder and CEO of College Together. Tonight, we will address some of the concerns folks have had in the face of the COVID-19 pandemic. We will be discussing voting, small business, community resources, and public health. First, I want to review a few housekeeping items. Everyone who is on the line, other than the person speaking, will be on mute. The best way to watch this is by clicking on speaker view on the top right-hand corner of your screen, if you're not familiar with Zoom, which we are all getting to be experts in, I think, in the next month. As we hold this discussion, you can raise your hand or go into the chat and contact my campaign manager, David, and he can reach out to you. So if you're not familiar with chat feature, it's at the bottom of the screen. There's like a little bubble, and you can send a message directly to David privately if you're having any issues or concerns. And you can also use that feature for the Q&A portion of this event. I'd also ask that if you are from the press or from another one of the campaigns, if you could just please identify yourself and send a message to David. In terms of today's format, after brief messages from each of our panelists, we'll then be moving to a Q&A session. If you miss any portion of the program or would like to share it with a friend, there will be a recorded version uploaded to our website following the end of the event. Over the past 2 weeks, a lot of folks have reached out to me and asked how I'm doing and how the campaign are doing. I just want to thank you all for your continued support. It really means a lot. Clearly, a lot has changed. We can't knock on doors or hold any in-person events. Like everything else in the world, we've had to adjust. But this moment has only strengthened my resolve. I am running for office because I deeply care about people. I believe that our government should listen to what people need and then act to make their lives better and happier, and should be held accountable if they're not doing that. We have seen with abundant clarity the extent to which the establishment has failed workers here in Pennsylvania. We need paid sick leave. We need a fair minimum wage of at least $15 an hour. And for goodness sake, it's beyond time that we have free access to healthcare. It can be hard right now to think about politics. Believe me, I understand that. But this moment is a wake-up call. On the other side of this, who do we want to be leading us? And what do we want our world to look like? The most effective way to get the progressive policies we need implemented is ensuring that we elect progressive candidates who support these policies. In office, I won't just be another reliable Democratic vote. I will be a champion and advocate for real progressive change in the Commonwealth. I truly believe that we are stronger together, even if we're temporarily apart. Over the course of the last 2 weeks, my campaign has had to change how we do everything. We've used our network of folks to activate and provide resources to people. The first thing that we did was we redid the content on our website. You can now find a lot more information about the issues that we champion and support on the Issues tab at vanessamagrath.com. We also added a section of the website, which is Campaign from Home, which includes a lot of links to resources both nationally and also locally if you're interested in helping folks. Another thing I'm really proud of is we have made over 2,000 phone calls to folks here in the district. The most important things that I've stressed to our volunteers is, I don't care if you even talk about the election. The most important thing is that we're maintaining connections with folks. It's really hard to be isolated. And so we've just been reaching out, having conversations, keeping folks company. And honestly, it's been the best part of the last 2 weeks for me, just talking to voters and people out in the district. The other thing that we've done is organize this event, which I have been really looking forward to this, and I'm really excited for the conversation that we're going to have tonight. So without any further ado, we are going to begin the substantive portion of tonight's event. Our first speaker is Ian McLaughlin, and I'm going to pass it over to Ian. Thank you so much for giving us your time this evening, Ian, and for everything you've done for the campaign.
Thanks for inviting me. So my name is Ian McLaughlin, and I'm going to do my best to convey, to the best of my ability, why public health officials are recommending such significant changes in our daily lives, even in the face of unprecedented economic hardships. And the federal recommendation, by the way, for sustained social distancing has literally just been extended to April 30th. And I'm going to try and keep this brief, but if there's anything that I can try to clarify, please bring it up at the end of the session here. I'm happy to go into some of the biology of this novel coronavirus, and it is interesting, but the most important part of it is that it's a brand new virus, one to which no one has ever been exposed before. It spreads very rapidly and very easily. And as a result, it's going to be months before we have a reliable vaccine, which is like the main arrow in biomedical science's quiver to confront viruses. And while we may get an antiviral medication sooner, it'll still be months before it's widely available. Even if one is successfully developed and tests and everything goes smoothly. So that's why we've all been hearing a lot about social distancing. And it may not be entirely clear what that means, but at its simplest, it means staying 6 feet away from other people. This is because 6 feet gives gravity literally enough time to draw down any viral particles that people cough or sneeze or potentially just breathe out down to the ground away from your body. And it also means not gathering in groups. And this is because while you or your friends may not be exhibiting any symptoms, you may very well have been exposed to the virus several days ago. And on average, it takes about 5 days for symptoms of COVID-19, the disease that this novel coronavirus causes, to present. And that's just the average. And there's also evidence of asymptomatic transmission, meaning that people who aren't even sneezing or coughing or anything like that are able to transmit the virus. So since there's no surefire way for you to know if you or your friends are sick, the best thing to do is just avoid exposure in the first place, and that means avoiding gathering in groups. So the payoff of social distancing is this. Every time you pass this virus to someone else, that results in several more people getting it, and I'm sure that sounds obvious, but the rate at which one transmission turns into a dozen, then hundreds, and then thousands is pretty rapid, and I think it's kind of unintuitive. So speaking in broad strokes, without any social distancing, one person who's infected, who again doesn't even know that they're infected, will result in about 2 to 3 people infected in 5 days. In 30 days, that turns into over 400 people. And remember, that's just from one initial person. And we can cut that over 400 people down to just 2 people after a month of somebody who has been practicing social distancing. And the main goal of social distancing here is to flatten the curve, which a phrase you might have heard of by this point. And so at this point, most models I've seen of how this virus will spread through the United States predict a pretty sizable proportion, anywhere from 40% to 80% will ultimately be infected. And so the goal is to spread out how many people will require hospitalizations at any one point in time. And so we know that COVID-19 is a slow and a long illness. And when people require ICU care, they can require it for days or even weeks. So minimizing how much that happens simultaneously is good for both those patients as well as for other patients. So that's to ensure that people get the medical care that they need for both COVID-19 as well as the other maladies that are already landing people in hospitals. So that's why everyone from mayors to governors on up have been emphasizing social distancing or even sheltering in place. And it's worth keeping in mind that even despite the paltry testing that's been conducted in the United States, we still have the highest number of confirmed cases of COVID-19 from the testing that has been done. And so there are good reasons to anticipate that this is pretty widespread already. So in addition to keeping around 6 feet between you and others, there's additional guidance, staying at home unless you're an essential worker, avoiding public transportation and ride sharing. And basically the city government is saying that really the only reason you should leave your house is to get groceries and occasionally to exercise, but even then staying 6 feet apart from other people. And there have been other studies that indicate that while the virus is fortunately vulnerable to simple household cleaners like bleach, rubbing alcohol, hydrogen peroxide, and soap, it seems to be able to stay viable on surfaces like cardboard, metal, and plastic. And so this is why it's worth washing your hands so much more regularly and thoroughly than you likely would have otherwise. While the primary mode of transmission is breathing in droplets when someone sneezes or coughs, it can also gain entry through the mucosal membranes of the face, like the mouth, the nose, and the eyes, if you itch them or touch them after touching an object with still viral particles on them. And this is also sort of the frustrating aspect of the timing of this virus. I know a lot of folks have allergies to the pollen that emerges when all the trees in the city bloom. And so if you're prone to allergies, it's probably a good idea to make sure you're mitigating those allergies particularly if you're leaving your house for whatever reason, to reduce that likelihood that you'll touch those parts of your face. All right, so on the state of affairs in Philadelphia. So Dr. Thomas Farley, Philadelphia's health commissioner, has noted that as of yet, we have not reached a point where hospitals or emergency facilities are saturated. But the expectation is that we're not close to the peak of spread in Philly quite yet. Dr. J. Larry Jameson, the dean of the medical school at Penn, says that the modeling that's being done at Penn predicts that the peak of the curve will likely hit sometime in the middle of May. And those numbers are probably going to change as we get more testing data available. When precisely will depend on how successfully we all practice social distancing, and we can help to mitigate just how high that peak is by doing the same. And so the city government has been pursuing ways to expand the hospital bed capacity of the city. And while the effort to reopen Hahnemann fell through, they came to an agreement with Temple recently to use some of their facilities. And so the city is recommending that if you feel symptoms, particularly respiratory symptoms, coughs, shortness of breath, or fever, you should behave as though you are positive for COVID-19, isolate yourself, and contact your primary care physician. Testing is going on in Philly, and a doctor will be able to refer you to testing. And so one last thing is that clinical care for other issues, particularly like mental health and addiction, will, unsurprisingly, be affected by social distancing procedures. And so the city has a Department of Behavioral Health and Intellectual and Disability Services, or DBHIDS. But folks who are confronting mental health challenges, and that includes addiction, it's worth considering visiting their website, calling their phone number, and seeing what services can be provided. And this is a broader topic, but regarding addiction treatment, there are digital recovery meetings that have been going on, and they've grown significantly over the past 2 weeks. And so far, the results have been pretty compelling. And another development within Philly is that survivors of domestic abuse can now file a protection from abuse, or PFA, by email or by phone, and you can email temppfa@courts.phila.gov. And there are other resources available as well, and the city has compiled all those in their press releases and updates on COVID-19 online. And okay, I should probably stop there. Let me know if there's anything I could try and clarify. I'll be happy to. And thanks again, Vanessa.
Thank you so much, Ian. I really appreciate that. It was a lot of really good information. I did not know the reason why it was 6 feet, that we're dealing with gravity here. And also great information about digital addiction meetings. That's very interesting and a great resource for folks. So up next, and if you do have questions, you can start sending them in via the chat, and we'll make sure we answer them during the Q&A section of this program. So at this time, I'm going to turn it over to Oscar Wang, who's going to discuss some of the economic impacts of COVID-19.
Thank you so much, Vanessa. I just want to start by saying thank you for allowing me to be part of this and for bringing us all together on what is day something of quarantine. I think I've lost count, and especially for really making sure that you answer the call to duty during this time of crisis. And I think this really is a crisis. I think for a lot of Americans, for all of us, we've felt the economic impacts, the social impacts, the psychological impacts of this, and that the federal government has decided to respond with a $2 trillion stimulus plan, the largest in American history, way eclipsing obviously the plan that came up in 2008 after the housing crash. You might have seen a lot of these headlines, and I think the main one that every American is currently looking at is that there will be checks. If you are an individual earning up to $75,000 per year, or a couple earning up to $150,000 per year, you will be receiving a one-time check of $1,200. Once again, there are a lot of numbers out there. There are a lot of articles saying there are proposals for $2,000 a month, $1,000 per month. Currently, it's just a $1,200 check. You do get, if you have a child under the age of 18, $500 per child as part of this payment. And for those of us who did file our taxes with the IRS last year, you will be receiving a direct deposit, the current figures are saying, over the next month. Of course, this bill was a lot of things. It would take probably to cover all of them. But I think what is important to know is that, one, if you filed for unemployment, those benefits will be extended by an extra 4 months. You'll get up to an extra $600 per week on top of what you will already be receiving. There are $500 billion of loans to many different types of small businesses to ensure that they can stay afloat. And this is also important, is that if your business keeps you on your payroll, you will be able to get a tax credit if you're the business owner for keeping them on the job. That will be reflected in the coming months. So we see a lot in terms of the effect this package has on individuals and on businesses. But I think in terms of Vanessa's entire campaign theme and her message, important is that if you talk to an individual, be they a laid off worker or a business owner, you'll see that a lot of people feel that government just is not doing enough, that Harrisburg nor Washington is really responding to our needs. For example, my nonprofit College Together, we work with over 30 18 to 24-year-olds who are actually currently locked out of this federal package. If you're 18 to 24 and you're in college right now, you actually are not old enough to be considered an independent if you filed as a dependent in terms of taxes with a parent or guardian last year. And you're also not young enough under the age of 18 to be able to receive federal benefits. So we have a whole population, a whole generation of young people right now across the United States, many of whom are trying to go to college, trying to find a job, trying to get an education, who are being locked out of benefits right now. Somebody needs to answer for them. And I've spoken to business owners. We partner with over 30 restaurants in the city of Philadelphia, small businesses, many of them mom and pop shops, to give our young people opportunity. And they are frightened right now because none of this right now is speaking directly to them. The McDonald's, the Burger Kings, the big chains in America are being spoken to. They have a direct line to the White House. They have a direct line to many lawmakers in Harrisburg, but they don't have a voice right now. They don't understand what it's going to look like 3-4 months from now. If we are definitely correct in that May is the peak for Philadelphia, this is another 2 or 3 months of no revenue, of uncertainty around business rent, about uncertainty in terms of how quickly people are going to feel comfortable going outside to shop, to eat, to start commerce again. And there's a lot of uncertainty right now that's simply not being managed and that's not being answered to. So my recommendation is that for everyone listening right now, don't just go out and vote, which we know is number one and very, very important, but go out and support that small business with a gift card. If someone's open and taking advance deliveries or orders for 6-9 months from now, definitely do that. Make sure to call your friends who own small businesses because they're going to have the brunt of a lot of these economic impacts over the next few months. We're not sure in our own analysis whether 50% of restaurants in Philadelphia will be able to survive 2020 at the end of this year based on what is happening and the lack of help that is coming from our state and our federal government. So all this is to say that for individuals and also for small business owners, the future is pretty bleak in terms of what it looks like right now, but there is hope on the horizon in terms of communities coming together to ensure that they GoFundMe and raise funds for those who need it, that there will be light on the horizon when it comes to commerce coming up again. And hopefully there'll be light on the horizon in terms of a new generation of leadership in Harrisburg, starting with this campaign right here. So the economic impacts right now are varied for individuals and for businesses. No one is certain what is happening. I think the number one thing that you can hear is, I don't know. But I do think that there's some clarity in terms of help at the micro level from small communities, and hopefully in the next few weeks, more relief in terms of loans and grants to small and medium-sized businesses.
Thank you so much, Oscar. You raised so many important points there, and I just really want to highlight the interconnectedness of all these issues that were coming, to light in this crisis, and the fact that we have so many young folks who are working their way through college because of how expensive college is these days, and how important it is for us also to be fighting for affordability of higher education as well. Thank you so much for sharing all that information for us. I found it very interesting and informative. And if you have any questions about this section, please make sure you take note of it or submit it in the chat, and we'll make sure we get those to Oscar. Next, we are going to turn it over to Jen Devor, who is going to talk to us a bit about the upcoming primary 2020. So thank you so much, Jen.
All right. Hi, everybody. Vanessa, thank you so much for hosting this. I think with all the different topics that we're going to be talking about tonight, one of the biggest themes is uncertainty, right? So continuing to have these conversations, staying up to date, informing each other is going to be incredibly important. So thank you for creating this platform. So last week was a big news day with the PA primary election on Wednesday, March 25th. PA lawmakers voted to delay the upcoming primary election by 5 weeks. This is an intense time, and that calls for intense measures. And so the new primary date is going to be June 2nd. PA is one of 10 states to do this so far, to make this move. And that's going to push our registration deadline back, as well as the mail-in voting app. And I'll talk about the importance of the ability that we now have a no excuse absentee ballot. But we have to be paying attention and seeing if June 2nd is still going to even be viable, right? We don't know when we're going to be coming out of this. So the mail-in option is going to be incredibly important. The registration deadline is now May 18th. So if you need to change your registration, update it, or if you or a loved one or a colleague needs to register, you now have more time to do that. And then the mail-in voting application, that's going to be due May 26th. So right now, after this call is over, I highly urge everybody to sign up for a mail-in application. The best, quickest way to do that right now is online at www.votespa.com/apply-mail-ballot. Maybe we can put that up somewhere, or we can share it after the link, or share the link after the call. You need a license or a state ID to fill this out online to submit your request. But I have to say, this causes a lot of disparity and equity gaps with the online application. Not everybody has access to computers or internet or is computer savvy. So if that, or not everyone has a state ID or a license. So there is going to be an option for a snail mail-in application as well, that will be on the same deadlines. I hope that there's a plan to distribute these. I don't know if we're going to be doing a universal mailing to everybody, but I think if you are on this call or watching this and you're a block captain or a committee person or a leader in your community, to print out these applications and make sure that your neighbors have them, that's going to be really important. And just because we're social distancing and we're staying home doesn't mean that we can't still be civically engaged. And I think this is now the time to rise to the occasion, right? We have to supplement marketing and promoting this election, and doing it in new and creative ways. So if you live in an apartment building or a community housing or a care facility, make sure that all of your neighbors are aware that this is happening, that we're moving the primary election to June 2nd. You can put a sign in your window, like I've done at my house, to let your neighbors know. Talk about it on social media, if you do have access to a digital platform, and then call your elected officials and make sure that they are able to provide anyone in their district that needs it with the option to vote by mail, and that people know how to do that, and that they have access to the application if they don't have access to a computer. It's really important that we do this, and we're just going to have to see what happens on June 2nd. Now, if June 2nd comes and we have people that are going to vote in person, there's going to be another challenge ahead of us. We're going to need new and more election poll workers. We already have a gap to fill if this was just a regular election year, but especially since a majority or most of our election board workers are in that vulnerable age population that's highly affected by the coronavirus. We have to make sure that we're filling in those spots so we don't put people at risk unnecessarily. I have no idea what this is going to look like, right? We're playing this day by day. We're seeing how it goes. Again, the importance of staying in communication on platforms like this. What I what I love about your campaign, Vanessa, and what I appreciate about the message that you're spreading and why, even though I don't live in your district, I've been so active in supporting you, is because I know you're already thinking about these things. We've talked about implementing automatic voter registration through, whether it's through the DMV or especially including that for high school students. This is an important election, so we have to get people to the polls. This election could swing the pendulum. We're 9 seats away from being in the majority. We can get redistricting control again. We're going to talk about gun control, which is now a major issue within the pandemic crisis because of the lines that we're seeing outside of gun shops, reproductive rights, getting people access to healthcare, and education too. I don't know about any of your viewers, but I'm a public school parent, and I think that there's a big concern about what's happening to our children's education now. One idea that I think that we can try to work towards, if the school district is delivering computers to their students, and that should be happening within the next few weeks, making sure that there's collaboration across the commissioner's office, across city council, and across the school district, that parents know that they can apply for the mail-in ballot application using those computers. I think that's going to be a win-win for everybody. And you know, I'll say it again, we are in uncertain times, but constant communication and being informed is what's going to get us through it. So I'm happy to stay and answer any questions towards the end via chat. And thank you guys so much. I'll put it back to you, Vanessa.
Thank you so much, Jen. I really appreciate all that information about the primary moving and all the dates in terms of registration being changed, and really good tips about how to get the word out about the change in the election date, and also that you can vote by mail, and you don't need an excuse to vote by mail in Pennsylvania anymore. So last but certainly not least, I am now going to turn things over. Oh, and I should say, if you do have any questions, and we do have some questions coming in on the chat, but if you do have any questions about Jen's portion of the presentation, do feel free to submit them into the chat, and we will go over them in our next portion of the panel. So now I'm going to turn things over to Michael O'Brien, who's going to talk to us a bit about community resources and also mental health. Thank you, Michael.
Hi, everyone. Thank you, Vanessa, for the opportunity to just dialogue with everyone at a really, really intense time. And so I'm happy to talk about community resources, but I do want to point out that I think the first community resource that we should be highlighting is actually each other. And I appreciate that theme coming through all of the other speakers, whether it's, you know, us thinking about social distancing and our responsibility to each other and practicing that even though it's hard, or, you know, what Oscar so brilliantly highlighted in terms of like thinking about younger folks, right? Those under 18, those between 18 and 24, 26. Even what Jen talked about with how we're going to need to be each other's kind of caretakers of factual news, right? At a time when there are so many things coming out and being said all over the place. So, you know, just extending that idea forward, I also want to encourage us to give each other some space to be human. These are really, really stressful times. And we don't have a citizen's playbook for this exactly. Like, you know, I appreciate particularly folks in Ian's world of work, where we have past pandemics to look at and think about population health and behavior. But as individuals having to deal with technology and the history of our city over the last 20 years, right, and the poverty epidemic, et cetera, like there's no playbook for how we're supposed to manage this right now. So many families, for example, are living paycheck to paycheck. You've got low income families, and you've got folks below the poverty rate. We've got migrants. We've got a lot of stuff going on here where just the average everyday experience was already kind of stressful and kind of chronically stressful. And then you add this on top. And I don't think there's a normative way to be right now. I think that we've got to be willing to question our own sense of like shared humanity and what does that mean at this time, and how should policy be operationalizing that. And so I appreciate your campaign picking up these spaces and values for us to all talk about. But I think, again, the first thing is we're going to have to give each other space to be human and not know how to feel, maybe cry sometime, maybe to take a distant walk with each other digitally, right? I can walk and talk at the same time, but reaching out to people and purposefully maintaining connection, and I think expanding connection talking to people that you might not normally talk to on a regular basis, just to check in on each other and see how we can just support each other emotionally. Secondarily, because of the things that I mentioned with income and poverty and the challenges that our city's been tackling for quite some time now, I think it's important to mention that in terms of resources, nobody's getting evicted right now. In fact, the mayor encouraged folks that if that's happening, call 911. Really appreciated him just putting that out there and being like, that's not a thing you need to worry about at this time. Also, utility companies have guaranteed there are no shutoffs. They're going to hold off on interest fees. It's an interesting time where we're seeing like some of the tenets of like capitalist, inclinations being challenged. I appreciate us, thinking about, again, how does a sense of shared humanity make its way into operations and policy and in practice. The other thing that folks should be aware of in terms of resources is that unemployment has suspended the waiting week, kind of like that 1 week in the hole before you were eligible to apply for benefits. So you can legitimately apply right now. You do not have to wait. I think this speaks to Jen's point around, again, connecting with neighbors. If you live in buildings or you live in spaces where there already are a bunch of people connecting, or even just getting with people digitally or over the phone to see like, hey, do you know how to fill out that form, right? And there's ways to ask that without sounding insulting, but we know the digital divide is huge. We know access is a huge issue right now. So thinking about how we can show up with each other or for each other in compassionate ways, and to conduct that kind of inquiry with compassion so we don't inadvertently shame people who might lack some resources right now. All these things are really important, but at our fingertips. The last piece I would want to bring up is around food. A lot of food insecurity, and also a lot of ways that people are, from government formally coming together to offer food sites. So there are a number of food sites spread across the city that the municipal government is partnering with. They'll be open, I believe it's Mondays and Thursdays from 10 to 12. There are food sites for young folks at about 49 different schools, and those are open, I believe, 9 to 12 on Mondays and Thursdays. And kids can get 6 meals at a time and then come back again. What's important to mention with the first set of locally based food options for families, there are no IDs required. There's no proof of income required. You legitimately can just show up and get food, no questions asked, which I think is super important, again, given the historic challenges that we're facing right now based on where the city has been and where we're trying to head. Last piece that I think is just really important in terms of community resources, again, going back to this idea of we're going to be some of our best supports around passing information and doing our best to make sure we do a little due diligence to make sure we're passing along factual information and good resources. There are a lot of independent contractors in the city, working in the creative economy, or folks who are working in the gig industry, service industries, et cetera. There are a number of grassroots supports coming together to offer $500 or $250 kind of very low bar, low question ask supports in terms of like free money, grants, et cetera. So I think just keeping up with those sector-based trends and sharing those things with people who you might know are, like Oscar was mentioning, barred from certain kinds of federal or state level resources, spreading that information is super duper important. I'm gonna stop there because I think that's 5.
Thank you so much, Michael, for sharing information about resources. And I also really love how you began by saying that our best resource right now is each other. That resonates with me, and I truly believe that. And so at this time, we are come together for Q&A. There's already been a few questions that have come through in the chat, so let me just scroll. We've also been joined by Timber. He wanted to get involved in today's conversation. So hello, Timber. Thanks for joining. I'm laying on my lap here. So the first question, and this comes in, I think this is probably best directed at Jen. So, and I don't know if there's been updates on this in the last week, but if someone requests a mail-in ballot, can they still then go to vote in person if it happens the situation's cleared up more and they don't mail it in? Do you know the answer to that?
Yeah, this is all complicated, right? And we're learning as we go, especially since this is the first year that we're voting with no excuse absentee ballot. So more people are going to use this option I think whether we were in this health crisis or not. So we're figuring it out. I believe if you apply for one, but do not hand it in, then you can still vote in person. I think that is the case, but we'll make sure that we follow up, and I want to produce the most accurate information, obviously, and avoid any confusion. I will say, to add to that, though, if you are going to vote by mail, I would apply as soon as possible. I know I said that in my brief overview earlier, but one of the reasons too is that we are going to have, I believe, an unprecedented amount of applications. And so we want to make sure that we give our election officials and the men and women that are going to be, and folks that are going to be going into the office to process these, enough time to do so. So that's just another thing to be aware of.
Thank you, Jen. We also shared the link in the chat to the votespa.com/apply mail ballot, where you can request a mail-in ballot in case you're curious about that. I have two questions that probably are best for Ian to cover, and I think this is a good way to cover some, maybe if you're able to chat about this, some of the information or misinformation that we're seeing. So the first is whether or not the masks actually help. That is one question that I've been seeing a lot too. And then another question is, some folks are saying on the internet that you shouldn't take Advil, that will make you more susceptible to the virus. So do you have any input on whether the masks are helpful, and whether or not it's okay to take Advil? Ian.
These are great questions. The issue regarding masks is actually fairly contentious, and there are some folks. So early messaging from the federal government was, you don't need them, they don't help. There was some disagreement, and this was covered, I think, the best by Zeynep Tufekci. I never know if I'm pronouncing her name properly, but she writes at the New York Times. Great article on just some of the issues with that early messaging. We've seen fairly recently this movement emerge on social media, but elsewhere as well, masks for all. And even Senator Toomey came out in support of it. And the notion is, broadly speaking, practically speaking, there's evidence to suggest that it helps. It certainly helps to prevent transmission if you're sick, right? That was fairly uncontroversial. The question is whether or not they minimize the likelihood that you will get infected. There's, from my perspective, there's, I think, good enough reason to use some kind of barrier. Doesn't have to be a surgical mask, obviously. Those were in short supply for quite a bit. And medical professionals certainly need them the most. But there are guides out there that are based on actual research that was done at Cambridge University and elsewhere, that basically quantified the efficacy of different materials, cloth, coffee filters or tea towels, things that you probably have around the house, and some really impressive sort of tutorials on how to make a good mask. I know some people are on Etsy making masks. So yeah, I mean, my personal perspective based on the evidence that I've seen is that, yeah, they're probably a good idea. They're not going to make a gigantic difference as to whether or not you'll get sick. But it's good to do if you have that opportunity available. Okay, the second topic was Advil. So that's ibuprofen. And early on, particularly when COVID-19 was rising in Europe and France was getting hit particularly hard, there was a physician who came out with essentially not an op-ed, but sort of just messaging that he felt that taking Advil specifically was deleterious to a patient's recovery because of the way it interacts with the immune system. Now, early on, that's, they were seeing the most patients, and I think a lot of people in public health and in biomedical science just sort of, understood that they have the most experience. But at this point, there's really no solid evidence whatsoever that there's certainly no evidence to back up that claim apart from the anecdotal evidence that physician provided. And so, I can tell you what I did. We were an ibuprofen family. We had a lot of Advil. We went out and got some acetaminophen acetaminophen is Tylenol, when that messaging came out. But at this point, I really don't think that that's a good enough reason to motivate you to go outside your house, and go pursue, other sort of anti-inflammatory drugs. And I wouldn't be too concerned about it.
All right. Thank you so much, Ian, for your response to those questions. Certainly appreciate it. The mask thing was something I was definitely curious about. Fun question. What is your favorite quarantine snack? I'll answer on behalf of Timber. His favorite snacks are he likes every snack. And someone also said Timber's cute, so thank you. So one question we got, this one will be for me. How can we help the campaign at this time, social isolation? Thank you very much for that question. So right now we're making a lot of phone calls and reaching out and chatting to people, which has been great for, you know, my mental health in isolation, to be able to talk to folks. So that's one way. If you're interested in doing some phone banking and outreach and talking to people, I think it's a great use of time and a huge help for us as well. And of course, you know, there's been a lot of articles in the paper about fundraising, especially when you are a challenger. So if you are in a position and able to make a contribution, that is definitely very helpful at this time, because we, as Jen has pointed out, have an additional 5 weeks of the campaign. So we are now in a position where we are doing GOT efforts basically for 10 weeks instead of 5. So that means a lot of digital ads, and basically doubling the amount of time we'll be doing our get out the vote measures, because ballots may be sent out as early as this coming week. So thank you for that question. Let's see, I think there's some, and we'll share some links in the chat to donate or look through our materials on the campaign from home section of our website. You can also find information on our website about how to request a mail-in ballot. Sorry, just going through the chat. There's a bunch of stuff here. This might be, Jen, could you just clarify which types of ID you need to have in order to request a mail-in ballot? I'm sorry if that was covered already.
Yeah, no, absolutely. So you need to have a Pennsylvania driver's license or a state ID number. Fun fact about me, I don't have a driver's license. I never have. So I just have a state ID. So, you know, very transit forward over here. But you can, you need to have one of those two to register, or sorry, to apply for a ballot on the online form. If you do not have one of those, variety of reasons why you may not, you have to snail mail your application. Right now, given the limitations of what offices are open, you can download the form online. But again, to address the digital divide that's very, you know, present in Philadelphia, I'm hoping that in the next few days and weeks, these service sites and these meal pickups, and, you know, with the connection to the school district, we'll have more of those paper applications available to everybody.
Thank you so much, Jen. Are there any other questions from those who are on the chat, who are on the Zoom here? Let's give you a few more seconds. If you have any other questions, making sure I didn't miss anyone. I think we've covered everything here. If not, we can end a few minutes early. Okay, well, I want to thank all of our panelists for joining us this evening. We put this virtual town hall together in only a few days, so I appreciate you all making yourselves available and offering up your minds and your talents to us so we can learn information about, you know, all the variety of topics that we've covered this evening. I found it really informative, and I definitely learned a lot and was really looking forward to this evening, and it did not disappoint. So I appreciate that. I appreciate all of you who have logged in from home joining us. We are hoping to do a few more of these events in the coming weeks, just so we can all stay connected and stay informed and see each other. I know that these Zooms and FaceTime meetings with friends and family have really been a tremendous source of happiness and joy for me in the last 2 weeks. It's a really good way to stay connected, because staying isolated is difficult, but it is very important for us to flatten the curve at this time. So, and if anyone's interested in learning more about the campaign, as we said, you can visit our website, VanessaMcGrath.com. We have information on how to vote by mail and request a mail-in ballot. We have information on how you can help us with our campaign from home efforts. One thing I will highlight is we added a children's activity to our website. So we'll be updating that PDF because I think it has the former election day on it currently. So, but you can print out a letter, and it's a good teaching exercise. If you have kids, I know it has to be terribly difficult at this time to be doing childcare and possibly working, but it's a fun activity where you can, a good teachable moment about what a state representative is and how important voting is. So you can go to our website and print out a little activity there. And there's also resources, both local and national, and if you are interested in reaching out and helping folks. And we'll continue to provide additional updates and information there, and information on future virtual events we'll have. So thank you all for joining us and for coming out. I appreciate everyone's questions, and I will talk to you all soon. So have a great Sunday night. Bye-bye.